Hey everyone, my name is Ambika. I am a final year student of O State Medical University, and I'll be discussing here a little bit about evidence based medicine with their guidelines. Starting with the introduction of evidence based medicine, evidence based medicines or EBM is about integrating individual clinical expertise with the best available external clinical evidence from systemic research. Now, what does this mean? This means that we are using our analytic skills in order to make a conscious decision procedure based on what available evidence we are having right now or in the present situations. So it involves complex and conscious decision making based on available evidence, patients' characteristics, their situations, and their preferences. Next, why it is important? Healthcare is individualized because every individual or every patient we are taking for this research is different. They're having different genetics, they're having different body types, so on basis of that it should be individualized. Next, constantly changing. Every procedure or every uh, drugs that we are been using should be modified, so according to their modification we have to change our guidelines in basis of that modifications. Next, it involves uncertainties. For example, in our present situation, we have faced COVID. So for COVID, in the early phase, some drugs have been preferred, which has been changed in the later phase, and those drugs have been modified to give good effects. So we have to check all those uncertainties to give our modifications. So there are three fundamental principles of evidence-based medicine. First one, best evidence summaries. Second, guides to confidence is estimated. Evidence is never enough to drive clinical decision making. Let's look on the first one, evidence summaries. It includes optimal clinical decision making, requires awareness of the best available evidence, effective literature search to help answer the questions, ideally systemic summaries of the evidence, other resources like primary literature and original research articles should be present, secondary literature to help locate specific articles, tertiary literature, the drug information and the resources, clinical guidelines, etc. should be present. The second one, guides to confidence is estimated. Two possible situations: evidence is trustworthy, which is high confidence in the data presented, limitation in evidence, which is uncertain of data presented. Evidence based medicine provides guidance to distinguish between these situations and the range of confidence between them. The GRADE approach is one way to assess quality of evidence. It is used to measure confidence in literature. The third one, evidence is never enough to drive clinical decisions. Ultimately, providers must always rate of benefit and risk, burdens and cost associated with alternatives, consider their patients' unique and the values and preferences. Values and preferences are the goals, expectations, predispositions, and beliefs that individuals have for certain decisions and their potential outcomes. PICO framework. What is PICO framework? The PICO framework is utilized to help define the question and focus your research for more clinical relevant evidence. So what does PICO comes from? PICO, the P stands for patient or population. The I stands for interventions or the exposures or the experiments we are using to give the evidence of our drugs or any procedure. The C stands for the comparison. Comparison, whether the procedure is good or bad, whether the procedure is having uh, major side effects or minor side effects. The O stands for outcome. What is the result? We are having a positive result in favor of the patients, or we are having more mutations or more bad bad outcomes. Rule of guidelines in evidence-based practice. So this is the guidelines which I have been discussed in the above slides. Clinical practice guidelines. Systematically developed statement to assist practitioner decision about appropriate healthcare for specific clinical circumstances. Recent uptake in insert in developing guidelines due to concern about variability in clinical practice, their cost, the quality, and legal liability. Guidelines also differ considerably in comparativeness, format, frequency of reviews, and ease of use. Guidelines, evidence-based practice guidelines. So here are some steps that has been used for the guidelines in evidence-based medicine. First one, identify and refine the topic of the guideline. Second, convey an appropriate group. We need to have a group, and that requires minimum 6 to 20 members, requires both clinical and statistical expertise, should be multidisciplinary. The third one, gather and assess the evidence, which includes systemic reviews of literature, their hierarchy of evidence. Translate the evidence into recommendations. Fifth one, use outside reviews to review the recommendations, which includes the user as well as the expertise, assess the viability and practically. And the third one, update the guidelines periodically. As we are having new updates, we need to update our guidelines. So here is an important pyramid, which is the quality of evidence hierarchy. It shows the upper side of this pyramid shows the higher quality evidence, and the lower side shows the lower quality evidence. If we look at the top, there is meta-analysis and systemic reviews. It is the procedures or the reviews that has been based on critical analysis and critical evidences are present to give this analysis. The middle one, which is randomized controlled trials and non-randomized controlled trials, this is based on the experiments. Then the cohort studies, case control studies, this is based on the observation. And the lower portion, which is case series, case reports, they are on the description of the patients. We do this. I'm not going much deep in this pyramid because there are topics which has been covered under this pyramid. Next one, I have added 2 examples for evidence-based guidelines based on article of 2017, which is of hypertension, and a guideline for this updated in 2020. So in this chart, in these guidelines, we can clearly understand what is means of the guidelines, how it is helpful for any clinical conditions. So that's all. Thank you so much, and I have added the references also. Have a good day.